It's a real pleasure and an honor and a privilege to be able to speak to you this morning. People often ask me, why I came to MD Anderson from the University of Southern California and one of the newest people here. And the answer is that I am challenged and inspired every day by the people I work with, and you have no idea how fantastic the speakers are to work with in real life, and they're really moving a needle for us. But I want to tell you that perhaps in the remaining sort of 6 to 8 minutes that I have the most important talk. So thank you, Jen, for that. And the reason is because we're talking about telemedicine, and this is where we actually touch you and you touch us, right? And the best technology is useless unless we're able to bring it out and help our patients with it. And so what is telemedicine? I know you can read, and as well, so I won't do that, but it's really the technology which we use so that we can actually interact with each other when we're not in the same place. And this is so important now during COVID, because social distancing is one of the effective ways of reducing the risk to ourselves and to our loved ones. 70% of the message is nonverbal. We know that. And you can just look at the picture. And Dr. Nelson has a cute sort of young one, which, when you look at them and they tell you something, you can just look them in the eye, you know what's happening. And this is, I cribbed this from Joe Navarro's book, and Mr. Navarro is actually an FBI investigator, and he has an entire book called What Everybody is Saying, talking about sort of the hidden messages as people are in front of you, and you notice intuitively. I'll give you an example. Last week during clinic, one of my patients and I had a discussion about, Jeep Wranglers are now, have 0% financing, and are for 48 months. And what he really was trying to say was the fact that, doctor, am I going to make it 48 months? And I would not have caught that had I not so looked him in the eye. This was an in-person visit. I want to spend 2 slides talking about what you see and what we see. And here, I'm going to leave you with the fact that that this is you can get this on YouTube as well, which has a live sort of demonstration of what happens. But going left to right, what does this telemedicine thing look like? What are we doing? What do you need to do? So, you need to have a smartphone or a tablet or even a computer. You need to download 2 things, the MyChart app and Zoom. And we're talking about the procedure we do here at MD Anderson. But I know, talking to my colleagues, it's a variation of a common theme, right? So wherever you are, whatever system you use, it's more or less the same thing. When you go in here, you have to actually go to the appointment, which is a televisit. The first time you do this, you actually have to go through and get set up, have consent signed, and a permission, and so on and so forth. I want to show you 2 screens that really have been the most problematic for my patients and myself. One is that when you get to the point where you have video preview, you have to say yes to the camera. And, I have to tell you, I stress test this talk last night with my 86-year-old mom, who at the age of 86 got her first iPad and is, FaceTiming everyone like mad. And with my sister, who is a psychiatry nurse, retired now. So, you can, it sounds intuitive, but not so. Make sure that you say yes to this. And then the next thing that people, that happens is oftentimes I see their face, but there's no voice and audio. So there are multiple ways of hooking in. You can have the app call you, you can call in, but remember you have to activate video. When you press this particular button here, it actually goes through your Wi-Fi connection. So that's what you see on your side. Here's what I see on my side. There's no HIPAA violation here. This is a sort of a made-up patient. I see this. This is my work screen, and the important thing is once you log in, I get a little thing saying patient is connected and waiting for me. So sweat pours on my brow because I have to really make sure I get there. And remember, no matter what happens, there's also a telephone. So if we have a hiccup, we're not connecting, either message us or call in the clinic live and say, by the way, I'm here, where's Dr. Wong? And every once in a while, I have to admit, as I was trying to figure out how this works, I would sort of miss this thing. So we're waiting for you and you're waiting for us. And the idea is that we're in a virtual waiting room, and when you get in, I actually click the thing that says connect, and then your face pops up. And that's really something fantastic. Now, I want to talk about 1 or 2 things that are problematic and I need you to help me with. And this is the one, if Dr. Nelson's here, she's the expert on this. But, this is skin cancer. And so sometimes I say, well, show me what you're talking about. I happen to treat non-melanoma skin lesions as well, and they're not always all pigmented, but melanoma oftentimes has pigment to it. But pigment and how it looks is a function of lighting. And this is I put slide 1 here, we're going left to right. This is one where my 86-year-old mother insists I put in, which is, where's the camera? Mom, it's here, because you have no idea how many times she wants to show me something. She had a little red eye the other day. And for the life of me, after 10 frustrating minutes, I sort of said, Mom, you know, where is the camera? What do you think it is? And so here it is here in the back, and this is in the front, right? The other thing is lighting. So I tell my patients, go to the most consistent lighting that you have, and that's usually sunlight. So, you know, find a window during the day and then use your iPhone, take a picture of it for us or illuminate it for us. The fact that you have consistent lighting tells us. And of course, people say, well, this has gotten bigger, this has gotten smaller, because that's one of the things we really focus on. Well, I need a reference point. So you can cast around for one of our rulers that we have. If you ask me, I'll give you a whole tape of them. But really, you can just put a dime in because we know exactly what it is and how big it is. So you have a reference point. So things like, did it change in color? Is there pigmentation change? We can answer that. One size does not fit all. So telemedicine is not for everyone. You know, this is one that my sister reminds me because she works with folks that are in severely disadvantaged in many ways, both cognitively and economically. And so we were making the assumption that we're all universally connected, but you gotta need a connection and so on and so forth. Obviously you folks are online with me, so this is not you. But for the folks that are looking at the global things that we can do with telemedicine, this is one of them. There are language and cultural barriers. We have folks with cognitive impairment and some of our speakers spoke about brain metastasis. I think it's very hard when you don't have a connection with that person to establish it remotely. So it really works best with established patients like the gentleman that talked about the 48-month zero financing for Jeep Wrangler. I knew him. And I knew when he asked the question that he really wasn't talking about cars, right? But as a new physician to you, that's also hard to make the connection. There are situations, try as we must, you know, we are just people trying to help people. And sometimes relationships is broken. And I'll tell you how hard it is to repair it virtually. So it's not a good place to do. You can try, but it's hard. There are situations where the medical situation is unstable. It's unfortunate, and these are situations where we just move on and either see the patient in person or go to the emergency department urgently, right? And of course, there are situations where the whole environment is not conducive to this. So it's important. I'm leaving you with this slide here, which is, you know, understanding telemedicine. It's about communication and connection, collaboration, and caring. So remember that, right? You can do it with any member of our team, and I've done it with any member of your team, right? Be it your spouse, your loved ones, as long as you give us permission to do so. We assume we all have an internet connection or connection via mobile, but remember, not everyone is facile with Androids or iPad, and I can't tell you, my nickname is Mike, the tech support for my mom, but it's okay, we get there eventually. You can do it anywhere you want, but really we need the privacy for you and for us. So here are some ways of doing this: headphones, earplugs, so on and so forth. And you know, there are multiple ways of doing this, and so we are richly endowed with sort of helpful things that can make this easier on you, but ask us, right? And call in, ask for the information, and we will find a way to help you get there from here. So that's my final slide, and just a minute over, and I appreciate being able to spend time with you. And again, the ability to interact with you is by far the key thing. This is how we bring what we have to you and for you to interact with us. Thanks again, and I'll take any questions. I can stay late if necessary.